When I started work with old people almost 40 years ago, many of them refused to go to hospital. The hospital for them was a symbol of failure. And of course it wasn't helped by the fact that the geriatric unit, as was common in many places, was based in the old Poor Law Hospital, because almost every town and city in England had the voluntary hospital and the Poor Law Hospital. And the Poor Law Hospital was where geriatrics was based. That's the place you go to die, they would say. I'm not going there. And sometimes I'd use the power of the law to remove them from their homes and admit them to hospital under what was called Section 47 of the National Assistance Act. Then hospitals got better, and many of these old Poor Law hospitals were closed or sold for housing or became headquarters for health authorities and trusts. But recently my friends in clinical practice tell me the same fear of hospitals is coming back. And that, of course, is principally due to hospital infection. Now a matter of common discussion in the public, even among those who don't have access to the internet. So nobody wants to go to hospital. Particularly at the end of life, it's good to stay out of hospital. The NHS Atlas of Variation, which we just published, shows dramatic and unwanted variation in the proportion of people dying at home. The reason why it's important to die at home if you want is because over-anxious young doctors and nurses don't intervene too much, as they tend to do in hospital. If you want a good death, you're more likely to have it at home rather than in hospital. If you've got chronic disease, it's also good to stay out of hospital because there is some evidence that problems get worse. You may develop an ulcer, or you may get an infection, or you may have further problems with your chronic disease due to the disorientation and the fact that the staff in hospital don't really know how best to manage your disease. Now, speaking of the detailed management of drugs and medication. So, stay out of hospital. That's the motto. And telecare can help people do that. It can, of course, contribute to saving money, but only if the money is actually taken out of the hospital sector, and that's not always easy to do. Telecare, what do we mean by that? It's a phrase that is difficult. Let me give you an example of a type of telecare. I'm thinking of a wonderful general practitioner in Oxford who went to see an old person once, and they'd had visits from 8 different professionals. He asked them, "Is there anything more I can do?" And the old person said, "Well, I'd like someone to change my light bulb, but no one's asked." So he did it. He then set up something called the fish scheme, and the old person in difficulty could put a fish up in their window, and one of the volunteers in the neighbourhood could take action. So they were using a means of communication, the Christian symbol of the fish. So telecare can make a big contribution to keeping people in their own homes. But we need to see it, first of all, not simply as a means of keeping people out of hospital, because some people with chronic illness do need to go into hospital to get an exacerbation sorted out. And we don't want to see it simply as a means of saving resource. We want to see it as a means of improving care and getting better outcomes from the patient's perspective. And from the patient's perspective, one of the most important problems they face is isolation. One of the first articles I published when I was working with old people those decades ago was called Brainwashing in Oxfordshire. In a survey with district nurses, I found that many old people were on their own from Friday lunchtime to Monday morning, longer than was necessary to introduce hallucinations and delusions in young, fit people. Brainwashing. The consequence of this was that we soon recognised that this had to be taken into account when looking after people. If, for example, you told an old person, "Just put your leg up and your leg ulcer will get better," we were telling the old person, "Just put your leg up and the district nurse will stop coming to see you. I'm afraid we'll never get you fit enough to get out the shops again, but we'll make you more isolated." For me, therefore, the vital importance of the phone, and a phone with a camera attached to it, is that it could increase the amount of communication that older people have with their communities. Not necessarily as a substitute for the face-to-face visits of the district nurse or the home help, but as a means of giving them more contact with other people. This, I believe, is one of the aspects of telecare that's not been well developed. But we need to remember our mission is not just to keep people out of hospital, it's to help people get better and feel better. And the wonders of the mobile phone and the wonders of using video communication should not be denied elderly people or housebound people. They may benefit as much from more social contact as from staying away from the risks of MRSA. So let's use phones to minimise the isolation of chronic care, as well as helping people stay away from dangerous places called hospitals unless they really, really need them.